Good evening and welcome to the Littleton Board of Health Wednesday, June 2nd Zoom meeting. We have no public hearings tonight, so we're going to start with the discussion. I guess it's all kind of tied into one, the discussion on Elder Human Services update with Ashley. I don't know, Ashley, were you aware you were the first one to speak tonight?
That's great. Thank you. Thank you for allowing me to be here this evening. I just wanted to share what our department's plans are moving forward with regards to scaling up the operation for indoor senior programs and activities. So right now we had registration yesterday for our June programs, and the primary focus was on outdoor offerings. So thanks to the Recreation Department for allowing us to set up at Fay Park as well as Long Lake Beach for meditation classes and Tai Chi offerings. We've been using the patio courtyard here at Town Hall for craft activities and book discussions, as well as meet and greets. So that's really the main focus for the month of June, in addition to our virtual offerings that we have, as well as our grab and go program opportunities. And we are going to proceed with caution in terms of bringing back the programming indoors. It's going to be a phased back approach starting in July. And we are going to kick it off the second week of July with the Welcome Back program. And I have someone that I'm working with, Mary Curlew. I'm really excited to have her. She's going to talk about transitioning back, re-entry into the world and in the environment, and kind of talk to all the different feelings that people are having because of this past year, especially the senior population. The most vulnerable group was asked to isolate and separate, and now we're transitioning back into quote unquote the new normal and all the feelings that are involved in that. So Mary Curlew, she's an LISCW. She provides community education and training. I actually attended a training with her through the Massachusetts Council on Aging monthly meeting, and she did a great job, and she's just going to adjust it a little bit for our town here in Littleton, and the plan is to have it on a hybrid platform for those people who don't yet feel comfortable transitioning back. And I think when we think of transitioning back indoors, people's comfort level varies, obviously, and trying to provide a welcoming space for people if they, for example, if they choose to continue to wear their mask, even if they are vaccinated, that's okay, and that should be accepted. And then also wanted to mention too that Littleton had applied for a China 15 grant in collaboration with Acton and Boxborough about a year ago, and we were awarded $30,000, and that money was to address the needs of the elders in the community as it relates to depression, isolation, and substance abuse, which kind of ties into the next agenda item. And we had a collaborative meeting this morning, and there's some plans for programming to talk about grief and loss. And I just wanted to mention, since those are collaborative meetings, anyone is more than welcome to join in on the discussion. So I can certainly send an email out to the board if you're interested in being part of those conversations. I find it interesting to hear what other towns are doing as it relates to this, because this is all new territory for all of us in terms of the transition back and trying to learn from everyone as we move forward.
Great. Is that You said act with Acton, a collaboration with Acton?
So it was a collaborative grant along with Acton and Boxborough.
Okay. Do you guys share that grant money, or is it evenly distributed between the 3 towns?
Yeah, so we all work together in terms of what we want to spend the money on. Thus far, it's been mostly for programming purposes. Grab and go. We had someone present with a presentation on a first aid kit for mental health, just to prepare people and talk about it. So that's some of the work that's going into thinking about reentry and scaling up the operation. So we'll eventually get there. It's just going to take some time.
Great, thank you. With the good weather, you guys definitely have to move inside, or is that because of the elderly and air conditioning and heat?
Yeah, so I think for June anyway, we have everything planned outdoors, and in July we'll start to transition back, and it will be a slow transition back into the building. For those unfamiliar with our space, we have shared space in the multi-purpose room of Town Hall, and then we have 2 small programming rooms. And I think too, especially in the beginning, we're still going to be limiting participation and having people call ahead, and having the space to social distance if people feel comfortable.
And I think Joe's on the meeting tonight. Is there space you have enough space?
Yeah, so we've been with Ashley and then Alicia and Park and Recs and Sam in the library meeting internally to talk about space and demands for space, so that we can try to coordinate some of the use within the buildings. And we're going to be getting into warm, humid weather, so we want to make sure that we're all communicating as far as bringing back some of the programs. With care funds, we had purchased air purifiers for all the space, so that we're well set up as far as maintaining air quality within the building. And I think Ashley had it exactly right, where we're not looking at just ripping the Band-Aid off and imagining the last 14 months, 15 months didn't happen. Want to bring things back in a rather strategic and well thought out manner. Starting with things outside, and then as we and also people become more comfortable, slowly bringing things back inside the municipal offices and our various space. We are constrained. We don't have some of the meeting space that we used to have. Also, some of the space that used to be used for other activities because of the library construction, namely the Cooper room, that's being used for storage. So, we don't have a lot of space right now at the municipal building for some of these activities. So I think it lines up well with the 3 departments sort of bringing things back slowly and in a more strategic manner.
Great. Thanks for that update, Ashley. Does anybody have any questions or comments for Ashley before we move on to the next discussion?
Yeah, I have a quick question for Ashley. I'm just curious, how much, it's hard to estimate, of course, but to what extent was isolation an issue? I'm just going to talk about isolation prior to the pandemic.
You always come with the good questions, Mike. I think
they pay me for.
I think the topic of isolation and loneliness has always been an issue, but due to the pandemic, it certainly heightened the community's awareness of what that is, and made people of any age realize what that feeling, what it really means. of course, prior to the pandemic, we were aware of the issue, and I think part of it has to do with engagement and trying to get people out and about. And I know we do have some supportive groups, such as our social anxiety group, um, living alone, living well. So if you think about people who may be isolated and lonely, you kind of think of the people that don't have many connections. So it's trying to bridge that gap and letting people know that there are supportive services out there and they're available. It's not a new topic, and I'm sure you know that as well.
Anybody else have any questions for Ashley before we move on? All right. So the next one is, thanks, Ashley. You're sticking around for this one. We've been talking a little bit about mental health services in Littleton, and I think this was maybe one of Kevin's babies too. Just seeing if there's anything that we can do to help. And I know that you've met with Matt Kennard, and you guys have some programs, I think. So can you just clue us in a little bit on what your department is doing for mental
Sure.
health for Littleton residents?
Yeah, absolutely. I think mental health is a very broad category, and it's critical to overall wellness and preventative service and early intervention for those at risk is most important. So I just wanted to start off by saying this past year with COVID was a traumatic experience for everyone. So typically you don't see the after effects until a little while. So the focus really was on basic needs. So I would say over this past year, people have been reaching out more with the social services, including financial programs, food insecurity, housing problems. And we do have an outreach department staffed with our assistant director, Nicole Sarvella, and our outreach coordinator, Amy DeMichelle. And they really provide residents with the appropriate resources when people come to them. It's very much a person-centered approach in identifying the need and what the available resources are to help and assist the resident. So very much resource and referrals, application assistance they assist with, such as fuel applications, as well as supplemental nutrition assistance program. So I just wanted to kind of start off by saying that. And then with the mental health component, there are many resources available, and I would hope that residents know to contact us to be directed. And what I could do, I kind of thought of it in three different kind of segments. One is if someone's dealing with a crisis, there's emergency help. And then another area would be if someone is ready, treatment therapy ready, that's another area of focus. And then the kind of third area would be for getting support for yourself or your loved one. So I kind of thought of those three different buckets, and what I can do is share my screen to our website, if that's an option. I think it is. I hear Joe's blinker. All right.
Oh, is that what that was? I thought it was a.
Sorry.
I thought it was a flaw.
All right, hold on one second. Let's see here. Okay. All right. So this is our department's website. And if you look for emergency contact information, so for people who are in a crisis situation, these are some hotlines that people can reach out to, obviously, 911 emergency situation, other helplines related to psychiatric emergency services, where there are mental health clinicians available 24 hours a day, the National Suicide Prevention Hotline, Samaritan statewide helpline. There's also elder abuse hotlines, as well as domestic violence hotlines, LGBTQ elder hotlines, and trans lifeline hotlines. So that's, one area for people to kind of be aware of. In terms of finding, for people who are therapy ready, the town is a subscriber of William James College Interface, which is a referral service. So thanks to Littleton for being one of the participating communities. And how this works is you would call the interface, and the interface is available Monday through Friday from 9 to 5. Here's the toll-free number. It's free, confidential, and you mention what you're looking for, and then you're matched with a licensed mental health provider within the area. And it takes about 2 to 3 weeks to be matched with someone who takes your insurance, who has that level of or area of expertise that you're looking for some assistance with. So it's a great tool, and we do, once people are ready for it, a place of reference to direct people. And we have heard from people who used the interface in the past, and they said it worked beautifully and that they're receiving the treatment that they need. So we've had many success stories with it. So we continue to promote this referral service.
And a lot of the therapy is being done online now too, virtually. So you could see a therapist in Boston and be in your own home, no travel time or anything like that. So.
And then, Lisa, you had mentioned the Littleton Coalition Against Addiction, and this was developed in response to the opioid crisis a few years ago. Littleton Select Board, I believe, took this on as one of their goals and priorities. And since then, they've done much with community education, teaming up with Chief Pinard on awareness and education and resources available for people who may be dealing with addiction. And in the past, they've had community events. I know I believe it was at the high school that they had an author talk of someone who was recovering, and that brought out a good number of people. And then they had Narcan trainings for the community as well. And we have some videos here with our assistant director.
Breaking up.
Contact information, yep, as well. And then I wanted to mention too the support groups that are available locally. In addition to the support groups that our department offers, which I had mentioned earlier, including social anxiety, living alone, and aging well, we also are offering a sober social through the Littleton Coalition Against Addiction. That's once a month on a Wednesday. And then I think it's important too to mention that there's another resource that was provided in response to COVID, which is the Mass Support Network, and they provide free outreach and supportive services to the community. It's statewide, weekdays, 9 to 5, and then for 24/7 support, people are asked to contact the National Disaster Distress Helpline. I can pull that up on my page here. Let's see. So providing services, resources, and screening. So I think it's important to just mention that there are many different resources within the town, and if any resident needs assistance in any capacity, to reach out to our department, and our outreach department will help and direct and provide resources in terms of which direction they're going in. And I think it's too, important too, just a public service announcement here, is to try and be active with the department, because new resources are constantly being developed, and we do our best to educate and share the information through our Facebook page, through LCTV, on the community scroll, as well as the PSAs specific to certain areas that Nicole and the chief had worked on previously and continuously do. So again, just mentioning that as well.
You guys have quite a lot to offer.
Yes, and we do have some programming in the think tank, I guess you could say. We had applied for a grant, again, through Jana 15, and myself, Amy, and Nicole went through the training for QPR, question, persuade, refer, because for suicide awareness, and we're trained now as instructors. So the thought is that we would train the community, so everyone could then be a gatekeeper and notice the signs of someone who may be having suicidal ideation or thoughts, and then providing them with the resources and tools to reach out. So that's something that's coming up or down the pipeline.
Very good. Very, very good.
So Kevin, you've been instrumental in bringing this to the forefront. Do you think that this is what you're thinking about?
My goodness, I had no idea that Ashley and her team had so much to offer in this regard.
So is there, and I think Amy Tez is in the audience tonight too. What can we do is there any other way that we can make this known a little bit more?
So,
Yeah, I think, oh, sorry, Kevin.
oh no,
I don't want to jump in on you, but I think, our philosophy is collaboration is key. And whatever we can do to communicate and team up what the resources are available to the community, the better everyone is. Regarding, the department, the staff, the residents, we are here as a resource. And if we can advertise in different ways to get the word out, we'd certainly be open to hearing that as well.
I mean, if Madam Chair, we had just had some initial discussions about developing a mental health task force to identify the needs of residents of Littleton, and trying to cobble it together to figure out the best ways to do that, and then hopefully bring those needs in front of the board and see how the board can help to meet the needs. I mean, it seems like you have everything in place to potentially meet those needs, but the more heads, the better. So whatever we can do to help get that done, let us know. I mean, I'd be likely to say, Ashley, would you please help us sort of head up the mental health task force and put it together with, community residents and Chief Bernard and members of the fire department to get all the professionals together to see, like, what do we need and how can we do to help and what's coming down the pipeline, in the next couple of years off the pandemic, and try and meet those needs the best we can.
That's what
Madam
you need.
Chair? Madam Chair?
I think at point they were wellness computers acting up. You guys are all frozen.
Me too.
Ashley, if there's a wellness clinic or something like that we can help you guys with, I would love to learn how to dispense Narcan. I think that's a great thing for everybody to know how to do. And so I don't know, was that you, Mike?
Yeah, I was wanted to ask a couple of questions, maybe just two.
Yeah.
One of the things that's really striking about all the things that I found, I mean, you did unearth a few that I couldn't find on the website. So thanks a lot for giving the deeper coverage. One of the characteristics, and I don't have, all I can do is point it out, is that a lot of the projects required someone to come forward. In other words, that there's a certain level of invisibility until the crisis is hit. And it becomes intervention or becomes clinical intervention where you have to invoke care, as it were. And on the other side, there's prevention. In other words, providing an environment or tools that, shall we say, reduce the frequency, reduce the occurrence of events. And I was just wondering, is there anything that goes on a scale where the environment for the elderly, for families that have who are about to face a crisis because of, and you can fill in the blank, is there a place where prevention community-wide can be brought to bear, as opposed to using resources, as it were, to treat the disorder, to treat the problem after it becomes a crisis? Am I coming across? I want to be careful not to turn this into an academic split. But there is something noticeable about our communities in the United States, the way we approach this, and the way, I hate to say it, many European countries, but not all of them approach it. And there's also the issue of social structure, family, and community and neighborhoods that are very different for us than they are in many other parts of the world. So I was just curious if you have ever had a chance to work with, or even to take a close look at, what we'll call preventive measures in the community for any of these.
Mike, I really like your questions. So I think if we're thinking of Littleton, it's a small community, and I think we're very lucky in terms of people reaching out when they're worried about a neighbor, a senior neighbor, their own family. So I think that piece of prevention is very much community driven in a way. And for us, in working with residents of the town, when I talked about the social services that we provide and having those conversations, sometimes you have like those light bulb moments that additional supports are needed. So I think too, and when you think about prevention, it's also continuous education in terms of what's available and then providing a safe space for people to reach out to. And I think our philosophy, or I know our philosophy, is really no wrong door. Everyone is welcome to contact us. And I hope every resident feels that way. I don't know if that exactly answers your question,
No,
Mike, but
yeah,
it's
I think it's a
food
tough.
for thought.
It's a tough one regardless. I was just trying to think of expanding, not because the effort you're making to educate and to announce is anyway falling short. It's a tough job to communicate what you're trying to do with websites and videos and all the rest. It is sort of one-on-ones, as it were. I mean, more than ones. And I was wondering, just are there, and maybe they don't exist here, and that is they can't exist for very practical reasons, but it's almost like a neighborhood, or shall we say, yeah, a neighborhood operation with education. And I'm not sure websites, videos, and of that sort work. And I was wondering, just out of, have you ever, this is just curiosity, have you ever priced the cost of some of the ads that are locally directed via the most cable watch channels? Have you ever priced that out? Okay, this is not Super Bowl stuff. I'm just simply saying, I'm just wondering if there isn't a way to have what you're doing across the board broadcast more widely among the community.
Yeah, I think excellent point. If I could, Mike, I would hire a hot air balloon with the department and the website and the phone number, so it's more visible. We did recently create a how well do you know the department communication piece, which is available on the town's Facebook page. It's available on our department's Facebook page. I can send it to all of you if you're interested, which really provides the scope of services that we offer residents in the community. And we were fortunate enough to work with Littleton Light and Electric with their utility bills. So hopefully some of you on the call were in receipt of this. But, Mike, that's a continuous conversation that all of us have on an ongoing basis. We're happy with the work that we're doing every day, but we know we can be reaching more people. And how do we go about that?
Go ahead, Dan.
One, thank you so much for being here tonight, Ashley. I have one kind of question, little easy piece. You mentioned a lot of things for outreach around the town website and LCTV and the scroll and those pieces, which are effective for a certain population here in town. I would hazard to guess more the E of the EHS is probably being reached that way than the other folks. Even simple things that have low costs like Twitter. It sounds like Facebook is already addressing a certain population that is slightly older at this point, more the people on the screen than off the screen probably. But Twitter and Instagram and even TikTok, where you can look at getting outreach to doing that education piece. So rather than waiting for someone to pick up the phone and call, both education but also resource awareness, some of these other pieces are, again, obviously that E in EHS is your anchor and most of your focus, but it's low cost, relatively low effort opportunities to maybe reach some of the other populations here in town that may need to be reached, whether it's awareness, prevention, or resource awareness. Now you got to put together a lot of great things. I do have a question. How did you identify the areas that needed to be addressed? How did you decide that, having you go through the question, persuade, that route was helpful and useful for you, your staff, and our community? Have you done a community awareness survey, whether it's working with Kennard and...
Yep. So the reason why we had applied for the grant was because the former director, Liz, actually, I believe, applied for it, and it was because of the which seemed to be a little uptick in suicides in town. So that was almost a direct response to that in a way, for an area where we could better assist the community as a whole with providing preventative tips and just to become more aware of the signs, because suicide is the most preventable form of death there is, and it's hard, like anything else, to talk about, but it's really important to ask the question, and this training will help residents know kind of what to say and how to best direct people. So I think for us, we'll probably see that training happening sometime in the fall.
Okay. Have you
to the community? And sorry, Dan, just one thing. I think we would be the first department to go with TikTok as a platform, but very, very progressive. I myself have never used it, but apparently it's popular with the younger.
Yes, it is. So it sounds like you've looked at some of those trigger pieces, but have you done like comprehensive community mental health survey, really identifying, from the Mass State data, from our local data, from outreach to communities, to really identify where our needs are and how we can best address them, or at least identify the needs? And if you have, awesome, because that's going to save everybody a whole lot of work. And if you haven't, well, then it's an opportunity for all of us to get to work and do good things.
Joe, you had your hand up?
Just wanted to also say that, especially because we've all been sort of sheltering in place for the last year, as we come out with new, or I was going to say new events, but really it's sort of like going back to some of the old ones. I think there'll be opportunities for like Ashley and some of the other departments to really take advantage as far as getting out there in the community. I know Park and Rec is starting to look at potentially having a third Thursday, and that was an opportunity really to highlight some of besides businesses in town, but also some of the services, and really start to highlight that. I think some of the issues we're going to be facing with mental health, it's going to be with us for the next couple of years as students are grappling with impacts from remote learning to maybe some social anxiety issues. And I think being able to now take advantage of additional communication out and additional programs to highlight what we do have may also help, as Dan was saying, like provide also some focus going forward in community engagement. And that can only help as far as also when we get into FY23 budget processes and really trying to prioritize some of our resources to address needs within the community.
Great, thanks. I was just thinking, we put signs up about masking for the businesses, the Mask Up 01460. Could we do a banner or something again, highlighting or just steering people to your department and your website at the post office so people driving through can see that? And Joe, you might be able to answer that, whether or not we have, I think that was CARES Act money that we used to make that banner.
Yeah, and I think that's where, I think it's an excellent point as far as, we were asking a lot of people to, mask up in order to protect the health and safety of the community, and I think, promoting resources to also help strengthen and support the community would be beneficial. So we can look at, what maybe. Especially with remaining cares, but then also with new ARPA funds, what we're able to do.
Okay. Yeah, and we also use the solar signs too in different parts of the town, so we could also steer people to the website too. All right. Any more discussion at all? Go ahead, Gino.
Ashley, may I speak to you? Is she there?
She is. Go ahead.
I'm here, Gino.
Okay. You say you got a grant. Grant is only for Littleton, and you mentioned Acton and Boxborough. Am I correct?
So we're actually very lucky to have multiple different grants right now, but the two that I mentioned, one was specific to training for QPR for our for the outreach department, as well as myself. And then we had a separate grant with Acton and Boxborough. Yes.
Now the question is anybody else from Acton, Boxborough will go in TV and tell the story like you told us, that you have a department that you're willing to help other people? Just asking, is anybody speaking on the other community?
Yes. So within those collaborative discussions, we have representation from Littleton, and we have a member of our Marge Payne, the Council on Aging chair, as well as our assistant director and myself from Littleton and Acton. I believe it's their health director. They have a few different people. The ZOA director there, their board chair, is same for Boxborough. So it's really a collaborative effort. I know they're always looking for additional input, and if anyone here on the call feels compelled to join in on those discussions, you're more than welcome to.
Because I thought maybe it was only you, because if it was only you speaking, I could invite you in my show in Acton TV, and you can just tell us stories you did here.
I'm happy to do that, Gino, but I also know my peer Sharon would love to do that for you in Acton.
Well, why don't you mention that? Tell them to get in touch with me, and maybe next week I can make arrangements so they can come. What you do, there is a lot of people that, like you said before, they're very depressed, especially for what happened in a couple of years. You know what I mean? And they're really down. And they wanted to see a little bit, some help. They need help. And if it goes on TV, and I make sure that goes every week for a while, people will say, gee, there is help there. You know what I'm saying? Because right now there is no help, honey. Nobody gives anything. Now that you have the grant, that's why I said, maybe she liked to speak in Acton. If you like to speak in Acton, we can do it next week. But if you don't want to, because you can, and tell your supervisor. Gino says he asked me to go to Acton and put this particular notice in Acton TV because there is about 30,000 people there. Littleton's got only 10,000, and you're a very good speaker. You can tell a story, and you'll be able to help many, many people.
All right, great. Any other questions or comments for Ashley? Go ahead, Kevin.
Gino's right. You're a very good speaker, Ashley. Thank you very much for everything you're doing. I didn't hear the answer to whether you have had a chance to gather community information in regards to other folks besides the elderly who might need services.
Yeah, no formal, at least to my knowledge, no formal survey specific to that area. I know a couple years ago, we had partnered with UMass, well, the department had partnered with UMass Boston for a needs assessment study, but that was a couple years ago. And I mean, great information was provided, but it's a very different time right now after the pandemic than it was a few years ago. So certainly a consideration moving forward. Dan, great comment.
I was gonna say, yeah, that's kind of what I was curious. So I personally would love to be to see that piece. And certainly we all have dealt with crisis, but the underlying needs in the community probably haven't changed all that much. I think probably COVID has only put an edge on the challenges or brought folks forward or brought things out that was already there, just in a slightly different way. But our population, the basic needs of our population, those baseline background level needs, probably haven't changed all that much. This is, COVID has been an acute mental health injury as opposed to our baseline. So if we can see that report, or if you are able to share that, I personally would love to see kind of where we were pre-COVID, because that's probably going to be more representative than right now, as we're all recovering from the acute trauma rather than the background noise. So.
And Mike, I don't know if you want to speak to the fact that, the national data probably doesn't really apply to us so much. So getting as much insight on the local information as possible is going to be the most helpful.
I have no idea to what extent the national data applies to us or not. It's very hard to tell. What I was wondering, Ashley, and I'm picking up what Dan was, as it were, looking at, would it be worthwhile to see whether or not in this current environment, funds might be available for undertaking a well-designed survey? I don't know. I saw the UMass survey. I don't want to put UMass down. It's very hard work to do. It's difficult to do, but it looked like amateur hour compared to other surveys of mental health I've seen. It was sort of like a hammer, as it were. So I'm just wondering, is there an opportunity, you believe, to elicit one of the major institutions around the Boston area in collaboration with us in Boxborough and whoever, that we could undertake shall we say, an up-to-date survey, well-designed? I was wondering if in looking at available funds from the state and the feds, whether or not that would be useful.
I don't know. That's up to you. Ashley, did you?
Oh, sorry.
It won't hurt.
This is the second time someone brought up a potential survey today. So I think survey is on everyone's minds as it relates to mental health or transportation or housing within the town. So I think, I can't speak for the town here, but if there's a way to not duplicate and combine efforts, if any of these projects move forward, I think that would be best. And I hear what you're saying, Mike. You definitely need someone has that skill set in coming up with the survey, because you almost have to predict what kind of responses you have in creation of those questions. But
I think
it's a consideration. I just know that there are other groups in town wanting to do surveys on, so I don't.
That might be something that.
Excuse me. It's not a question of you doing the survey. The question is, it may be worthwhile for your department, or in conjunction with, even if unless we get in the way, the Board of Health, to basically solicit participation. I'll use the word directly, in certain institutions in the Boston area, and to see if they're interested in basically coming to the community with a well thought out, shall we say, diagnostic survey. Not a survey, but a diagnostic survey. Answers, I think, the question that was raised earlier about what is really going on here now and what's going on, what will be going on afterwards. If there is, what does the afterwards look like? So it's not waiting for someone to come up with a survey, to walk in the front doors, to go out actually and see whether or not there's an institution prepared to do this and join in raising the funds and all the rest. I am very confident that the CDC would be more than passively interested in that.
I
Joe,
would,
you had said, go ahead, Joe.
yeah, I mean, I would say I think that it is something, you know, worth looking into, you know, and supporting Ashley. You know, we can look to see, you know, what other examples may be out there. You know, I think one of the things, as far as working with other universities or other groups, you know, is nailing down the scope as far as what is the nature of that survey. What are some of the you know, the inputs that are being sought, and what are some of the objectives that, you know, we'd want to get out of those. Ashley has a very extensive network as far as resources through associations that she belongs to. Same thing with municipal managers associations. We also have resources that we can tap into to inquire whether or not anyone is looking at these, and can come back and discuss further with Board of Health. There are, you know, other surveys that the schools may be doing, so we'd want to have a dialogue with them as well, you know, as far as trying to then reach out to make sure that we capture a real selection of the community.
Great, that sounds great. So we can continue to discuss this. Should we reach out to the school first and see what, if anything, they're doing also?
I think that's one of the missing pieces, and the ones that probably have direct access to some of the members of the community that are also most in need.
Another group. All right, so should we continue the discussion, and then would it be Lynn Snow that we would ask to join? Okay. Janet, will you be able to do that? All right, so I don't think it's next week. Janet? What will
Right. Our next meeting will be on the 9th, so I can reach out and see if she's available then.
Okay. All right. Ashley and Joe, would you be able to come next Wednesday?
Yeah.
Yes.
Okay. All right. So lots to talk about. All right. And so everybody all set? We'll continue this discussion. Board members?
Okay.
Okay. All right. Thank you, Ashley. Great job. Great presentation. Thank you, Joe, for your help. We're going to move on to the COVID-19 update. You all set, Jim? Thanks, Ashley.
Sure. So that fortunately, with the reopening of the state, the 29th, that part of it, most all of the restrictions except the exceptions to the mask mandates kind of been rescinded. So gathering orders and all that. I think one last order, the governor's executive order for the emergency, the state of emergency, I guess they're working through that for the 15th of June to try to make sure they can kind of wind back some of the orders that were put in place and do it in a systematic way. As far as numbers go, last week there were 3 cases in a 1-week period in time in Littleton. The 2-week rolling, the information that I gave Mike, there were 4 cases in that 2-week rolling that the state reports. The number of cases in the state are under 6,000 active cases. So all of the trends seem to be headed in the right way. Vaccinations, I think that's one of the things, and we hear all kinds of stories about all kinds of incentives to try to get people to vaccinate. I'm not quite sure how it works. I mean, we had 110 people last week at the clinic. We had 60 today, so I don't know what to do. We've reached out and tried to make sure everybody knew the clinic was there and it was available for people. So we'll keep plugging at it.
Like Dan said, put it on TikTok. You said 60 or 16 today?
60.
Good. Well, that's still.
Yep. Still moving forward.
And are you seeing more kids, the younger?
We are. I mean, last week was about 75%. This week, probably about 60%. So, yep. Interesting things. The kids who come in, doesn't seem to be any kind of like, I don't want to be here kind of thing. They just come in and get their shot and go. So I don't know if they're kind of internalized. It's like, I need to get this shot so I can get back to normal. But
yeah.
So hopefully that's the message.
Great. Does anybody have any questions for Jim? Does that mean, actually, sorry to interrupt, are we in the green with 3 or 4 cases, or
Almost.
Gray.
still in the gray?
You might go to gray. Last week we were green, so it's
A little bit.
sometimes my number is 1 or 2 off based on, how it happens because I'm pulling the same numbers that DPH pulls, but so it could be green or gray depending where you're at.
Okay. Questions for Jim, anybody?
Is there anything we can do to help promote the clinic?
One of the reasons we asked for the Pfizer was to try to be able to target kids. And so we've sent it out to the schools and, I'm not sure if there's any other congregation of young people that you can kind of tap into and say, hey, look at this. I think part of it is, some of the regional collaboratives are closing because of the demand is down. It is now more widely available. Now, I don't know if they're doing Pfizer at like the drugstores and that, only because of the handling part of it and the amount that you have to get. So I don't know how widely available that is, but nobody seems to have problems getting kids vaccinated. So.
Yeah, I heard that 58% of the 12 to 15-year-olds have their first shot.
No, I think it's great.
That's like amazing.
Yeah.
In 2 weeks.
Well, because I've heard stories. We set hours like 12 to 6, hoping that we could catch kids after school after. But what I'm hearing is that parents are just taking kids no matter when. They just go get the shot. Yeah, that's right. Yeah. So the hours don't seem to matter. But
cool.
Yep.
Are you going to keep using? Do you have like a certain amount of vaccine that you're going to use up, or do you get more vaccine every week?
We with the Pfizer, you get 1,200 doses, or 1,170, I think, is the tray. Mm-hmm. So we're at a point now where we've got plenty to continue. So
okay, all right, go ahead, Dan.
So we're talking about the mask mandate going away. I just want to make sure that we're clear for everybody that it is not completely gone yet. There's still a mask mandate for public transportation, taxis, livery, those pieces. Inside K through 12 schools, healthcare facilities, congregate living places, basically places with vulnerable populations. So that we're kind of throwing all the rules are out the window. We're all done. It's all over. But we're not quite there yet. I just want to make sure that the message is clear that schools and hospitals and riding the T into town, all those pieces, that the mask mandates are still in effect. Would you agree with that, Jim?
No, that's right. So that when they lifted the mask mandate, there were exceptions, and those are the exceptions that you described.
No, I'm happy that we're almost done, but I just want to make sure that we are sending a clear message to everybody out there that if they walk into the school and they ask them to put a mask on, that we don't end up with. But Jim said, or the Board of Health said, that our messaging is clear and consistent. So
right. Correct.
All right, great. Thank you, Jim. All right, and so next on our agenda was the vote regarding acceptance of the CDC and Governor Baker's revised guidelines. I talked to Anthony today, Dan, and he thought it was fine to do, but since we had never taken a vote or a motion to go against what the CDC, we've always followed what the CDC and the governor had recommended. We didn't go rogue, and we didn't pull a Cambridge or a Boston or a Somerville. He said we probably don't need to make a vote. I don't know, Joe, can you elaborate on that?
That's exactly it. And talking to Anthony as well, he had discussed with me that exact conversation, Lisa, that since the town hadn't adopted it or made any separate declarations on its own, basically just following CDC, there's nothing that we're rescinding or extending a local order that was different. So he had just basically said the same thing if it came up with the board that it really is more optional from the town's perspective as far as making a statement following CDC guidelines.
Yeah, I read these. Sorry, Madam Chair. I read this vote very differently. It had nothing to do with whether or not we approve or don't approve of. It was basically, as far as I can say, this was simply a vote that we encourage the town to continue to follow the CDC and Governor Baker's revised guidelines, period. I didn't think that we were being asked to vote whether or not we're going to stand behind them and enforce or not enforce. It was an encouragement on our part to encourage the town simply to pay attention to the guidelines. I didn't read it as quite as, shall we say, legalistic as Anthony and Joe seem to treat it as.
Okay. So go ahead, Kevin.
I would just like to state that, the CDC guidelines have often, not often, but sometimes been different than other guidelines put out there, such as DESE. And I'm in full support of supporting the CDC and Governor Baker's revised guidelines. And I'd make a motion to support those as Board of Health.
I don't know if we can make a motion or just make a recommendation.
Yeah, I just want to do an encouragement thing.
Yeah, right.
Yeah.
All right.
We had it as a vote on the agenda, so I'm just making a motion.
Okay. All right. So make a motion to support the CDC and Governor Baker's revised guidelines and continue to, follow those guidelines, the new revised guidelines. So you made the motion. Is there a second?
Second.
And we'll do roll call. Kevin Baker.
Baker, yes.
Gino Fratelloni.
Gino Fratelloni, yes.
Dan Kane.
Dan Kane, yes.
Mike Zeldin.
Mike Sullivan, yes.
And Lisa Flanagan, yes. All right. Thank you. Move on to correspondence. Anybody have any correspondence that they want to?
Yeah, I got one. It came actually through, I think, Janet. So it's all of us got it, and I thought I'd just mention it. It looks innocent enough. It has to do with the Board of Health and the Agricultural Commission. So I have a device here that does, well, it doesn't matter the details, but it picks up very quickly keywords. I don't have to listen to the whole thing; just rips through it in about 30 seconds. So it picked up a few keywords, so I got curious and slowed it down to, to something I could hear. And it turns out, I suggest that other members at least stay with play the video and just be patient with it, because there's an attorney on it, and two surprising facts jumped out at me from this correspondence. The first is that except for items relating to, according to what the attorney said, except for items related to septic and disposal of gray water, I'll use the euphemism, we are not required to have hearings on any regulations we may seek to promote or pass. So check that out. I'm not saying that's the last word on it, but that's what the attorney seemed to feel. This led to the following, and that is that the rest of it has to do with encouraging boards of health such as ours to, there has been legislation put through in the Commonwealth that would require us to inform the Agricultural Commission about those regulations and give them 45 days the opportunity to respond if they wish to respond. They can say, we don't care what you're doing about that regulation that affects agriculture. We're not going to respond. Or they can take their 45 days and do it. And the idea is to promote agriculture in the town, and to do that in a healthy way, form shall we say, a more working relationship with local boards of health. So I'll stop there. I don't know if the rest of the video is nearly as exciting, but I suggest that some more ears. Maybe Joe wants to listen to it too, because it is the Agricultural Commission in town that would have to be, as it were, in communication with us, and it's probably a good idea anyway. So I'd like to share that with you.
Sure.
Because it looked innocent enough.
At least a little bit more about that, Jim?
So there's a general law that gives boards of health regulation making capacity, and as Mike mentioned, the regulations that go above and beyond Title V require boards to hold public hearings, and it's prescribed in that general law how you actually go about that. Otherwise, boards of health have pretty broad regulation making power. I think, and I haven't seen this, I know there was a seminar out there about agricultural commissions and board of health regulations. There are times where boards make regulations to address animal nuisances, and I think that's probably the big one, whether it's stable regulations, whether it's the keeping of chickens, whether it's, and so I think what the intent of whether it's the general law that the state or whatever the state had passed was to encourage conversations between agricultural commissions and boards of health when boards are considering regulations. I remember doing keeping of large animal regulations up in Ashburnham, and we purposefully had public hearings on it because we wanted to have buy-in from the people in the community making the regulations. It's even if, and I think the board didn't take all of the recommendations, but they did hear them all. And I think the community was much happier with the regulations because they actually had a part in it, and they could inform the board. I mean, depending on the board and what your backgrounds are, you may not know a whole lot about the keeping of animals, and so it's certainly good to have the community. So I think that's the nature of that. I haven't seen the video, so.
Okay. Great. So we've got some homework to watch the video. Must-see TV.
It's not a Netflix special. That's what I got to tell you.
Is it on Netflix? No, I'm kidding. All right. Anybody else have any correspondence that they want to mention? Now, Jim, we received something. I don't know, just something from about the Littleton High School water treatment system.
Okay.
And if you can read, I think it's page 14 of 24.
Okay.
Do you have it, or?
I don't have it, but I'll.
Okay. So it says reporting package comments. If you could read that and just let me know what that means. All permit parameters were met this month at the time of inspection, with the exception of effluent nitrate and total nitrogen. The exceedance may be attributed to insufficient carbon source, methanol, to complete the something gentrification process.
So I can give you kind of a quick and dirty on that. To be able to, when you're doing wastewater treatment, the denitrification process, there's two parts of it. You got to nitrify all of the the ammonia that's in wastewater, and then you do a denitrification process. That denitrification process needs some kind of a carbon source. Some of the carbon sources they use are things like methanol. There's a proprietary product called Micro C. I've even heard of people using sugar and stuff like that. You add to the wastewater to provide that extra carbon so that the denitrification process works. Sometimes more material, again, this is just from years of reviewing reports. Sometimes more more methanol gets added than is needed, whether it's a problem with a pump or whether somebody overcalculated. So I would understand the comment to be that, but I'll take a look at the report and give you.
All right, yeah, and just let me know. Obviously, some other people are looking at this and know what they're looking at too. So, go ahead, Kevin.
Best question ever. Best answer ever.
All right. Anybody else? So on to member comments. I received a call back from Conscom about the porta potties, and they have never put porta potties at the trailheads. So I don't know if you want to get back to that person that wrote to you, Dan, but I guess there's never been porta potties at trailheads. So
I will be happy to bring that back to the person who brought it to me. And then the only discussion would be, is it something that the board, the community, Conscom would want to look at as a way of promoting outdoor behavior and protecting our environment from unintended human waste in non-controlled environments.
all right, we can talk about that.
Was that nicely enough said?
Yeah, very nice.
All right, we can add that to a discussion some night. Any other member comments? And any public comments? Anybody have their hand raised at all, Janet? Okay, so let's move on to the minutes of May 26th. We have a motion to approve. Nobody wants to approve?
I'll make a motion to approve the minutes. I'm sorry, Kevin, go.
Go ahead, Kevin.
Motion to approve. Minutes on 5/26.
So can we get a second?
Okay, I second it.
All right, we'll do roll call.
I beat you, Mike.
It's not a race. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Gino Ferraro, yes.
Dan Kane,
Dan Kane, yes.
Mike Zeldin,
Mike Selden, yes.
I beat you, Mike.
Lisa Flanagan, yes. All right. Next meeting, I think
9.
Janet said the 9th. And then I think after that, we're going to go to the 23rd.
Okay, beautiful.
Okay. We're still going to be doing Zoom, Gino.
I know.
It'll go back to every other week unless something happens.
Second and fourth Wednesdays.
Second and fourth. So
If there's a 5-week month, it's not every other.
okay. So what will be the 6th, the 9th, the 16th, and the 30th this month?
Well, today was an extra one that you folks wanted to add. So it'll be the 9th and the 23rd.
Okay.
And then for July, it would be the 14th and the 28th, second and fourth Wednesdays, the way we used to do.
Mm-hmm. So in July, it will be what?
The 14th and the 28th.
Okay. Gentlemen, if you could tell Janet when you are not going to be available, if you won't be around to attend those meetings. All right. Go ahead, Kevin.
You said there'd be homework.
Watch the video.
That's it.
That's it.
Yeah.
She didn't know about that before this meeting, though, because last meeting she said there was homework, but that homework just came up.
Mike, is there anything we can do to help your cause with the select board? And
It's
Oh, boy.
thank you for offering. There's ongoing discussions.
so no, not at this point.
Not yet. I mean, if anything comes up, I have to get it on the agenda and all the rest. And we're not at that point quite yet. Remember, we have town meeting coming.
Mm-hmm.
Well,
And so that the first step is being, at least theoretically, the first step is on the warrant. But you knew about that, so there's no news beyond that.
Yeah. I unfortunately have to work on that Saturday, so I will not be attending town meeting. So
You have proxy for that? Can you do an advance ballot mail-in?
I don't think so. I think that's the beauty of town meeting. You got to be there to vote. So, all right.
Motion to adjourn. Or-
Second.
Dan, did you have a question? Sorry,
Uh,
guys.
So we kind of blew through member comments. So we talked about correspondence. I didn't hear a member comment section. I just wanted to take a moment if we can, if that's all right, Madam Chair.
Sure. Yeah.
Just recognize June is Pride Month, and certainly as we're talking about mental health, that certainly as we look at our LGBTQ&I population, that, you know, certainly for youth members of that population, the depression risk, suicide risk is twice that of the heterosexual population. Mental health issues in general across the ages are 4 times as common among that population. And the biggest thing we talked about earlier about prevention is really just creating an environment of acceptance and recognition is probably the most effective, not easy, but the first step to addressing a number of those issues. So certainly as a Board of Health and as an individual, you know, certainly recognize Pride Month and that hopefully that we are a welcoming community, we are accepting community, and that we're all on board with improving our community and its mental health.
Well put. Thank you.
Thank you.
Oh God, what happened?
I don't know. You're upside down. What's going on with you?
All right. Is there any other member comments? And,
Yeah. Trying to be straight, will you?
That's not accepting, Gina.
Can't
Doesn't
see
matter
you.
whether I'm straight or not.
Come on, show me. Are you okay now, or you are still
You're not
upside
getting,
down?
you didn't get my joke. No, you're not getting my joke. All right. So, sorry to rush through that.
Motion
Dan.
to adjourn?
Motion to adjourn. Can I get a second?
Got a
Second.
second.
All right, thanks, Mike. We'll do roll call. Kevin Baker,
Baker, yes.
Dan Kane,
Dan Kane, yes.
Gino Faralloni,
You know, say yes.
Mike
Second
Zeldin,
Mike Zeldin, yes.
and Lisa Flanagan, yes.
You happy now,
All right.
Mike?
We will see you next Wednesday.
I'll see you Wednesday.
Good evening, all.
Good evening.